Hi, Jackie here from Cheltenham Podiatry. We're talking about platelet rich plasma. What is platelet rich plasma? It is a form of regenerative medicine that harnesses the body's ability to heal itself. Blood is drawn from the vein in the arm, same as when you get a blood test. It is then centrifuged in a machine to separate the different parts, including red blood cells, white blood cells, platelets, and plasma. They are all separated. The heaviest molecules will go to the bottom and the lightest at the top. Red blood cells are the heaviest, causing them to sit at the bottom, as you can see here in the test tube. In the middle, you'll have the majority of platelets, where you have the line between the red blood cells and the yellow plasma. On the top in the plasma is also some very useful anti-inflammatory proteins called IRAP and A2M. There are many other small molecules in the plasma, including exosomes and mitochondria. But generally, the main important component used in most PRP is the platelets that contain the growth factors that are anti-inflammatory and encourage healing. The platelets, however, need to be collected in a very high concentration in most cases and are often combined with the more anti-inflammatory white blood cells and can then be re-injected into the damaged tissue. However, the platelet pool plasma, the yellow section at the top here in the tube, can also be used with the PRP or separately in various conditions to enhance their anti-inflammatory effect of the IRAP and A2M proteins. What sort of conditions can be treated in the foot and leg? PRP is effective for stage 1, 2 and 3 arthritis, and sometimes even in stage 4 arthritis in the knee joint, ankle and smaller joints. Other tissues that can be treated include chronic plantar fascia or fasciitis, Achilles injuries. It can also be used in many tendon, ligament and joint injuries, including severe ankle sprains where there may be ligament tears and tendon tears, as well as damage to the ankle cartilage. Who would be a good candidate for PRP? Well, anyone who can't have surgery is definitely a good candidate, or those that want a faster, speedier recovery than the normal standard care. Also, there may be those that want to get back to their sport or activity as soon as possible. Typical candidates are either young sports players or active over 50-year-olds, golfers, tennis players, etc. However, as we age, the platelet quality and the number of growth factors released from the platelets is reduced. Thus, it is important that a larger volume of blood is drawn in older patients or those that have a reduced platelet number to ensure they get a good result. For example, recent evidence points to a required 10 billion platelets in Bansal et al.'s paper for knee arthritis. It is also required to inject under guidance. Often ultrasound is used to ensure that PRP goes into the appropriate location. So as you can see, there are many variabilities in PRP in how it is made and how it is injected. So if you would like to investigate to see if you are a good candidate, please contact us at cheltenhampodiatry.com.au or call us at Cheltenham Podiatry, Melbourne 03 9583 3093, Melbourne, Australia. Bye.